Myself, Shashikala Wali, working as Associate Professor, Department of Pharmacy Practice, Scale College of Pharmacy. Welcome you all for this seminar on rational use of drugs. I'll be discussing regarding the what is mean by the rational drug use, as well as most frequently irrational or abuse of drugs, and what are the steps are involved for improving the rational drug use. And according to the WHO, what are the drug use indicators are there, followed by what are the guidelines for rational prescribing, as well as irrational use of antibiotics, rational use of antibiotics, and finally, what is the role of pharmacists contribute towards the promoting the rational use of drugs. These things we'll be discussing. So now coming to the introduction, what is mean by rational drug use? So here, the patient receives the drug should be appropriate one, and it should be a timely use of drugs for an ailment which is a properly diagnosed by physician and prescribed in a right dosage of the right regimen and the right time for the right treatment. So usually like the patient receives the drug should be effective one and right indications, right time, and cost effective is also one of the important aspects for using of the rational drugs. So what is mean by irrational use of drugs? So how it is going to contribute? So especially most of the people are using of self medication, as well as how they can get the easily for the prescription drugs, either fast access to the over the counter drugs or the non prescription drugs, and prescriptions only drugs are easily available without the doctor's prescriptions and advised by the sometimes patient friends, either relatives, either person on medications, and not filling the whole prescription, self decision regarding how and when to take the drugs. So promotion of advertisement in the newspaper for some of the antibiotics are also giving the some of the advertisements and TV, radio by drug manufacturers, and pharmaceutical marketing to the prescribers and false and misleading claims. So self-medications without doctor's prescriptions and potent drugs for small disease also, like high dose of potent drugs can be used most of the time for the cold and cough. Antibiotics can be used maybe, and drugs which are used for something for which they are not meant for the particular diseases or particular treatment, and drugs which are not used according to the proper regimen, that could be one more reason. And using of aspirin, and we think that it is a safe drug. Taking in overdose may leads to ulcerations and bleeding can occur, because these, especially NSAIDs and as well as the antipyretic drugs, antidiarrheal drugs, some of the antibiotics are also can be used for over-the-counter drugs. So carefully we should monitor them, and we think that these drugs are safer, but over-the drugs and non-prescription drugs are most dangerous. Ibuprofen commonly misused drug for the pain purpose. Even diclofenac misused for the small diseases and small purposes. Disease purpose can be used. Nimesulide after ibuprofen and diclofenac most commonly misusing the drug. Elementary drugs, antacids, most of the people are taking antacids without the prescriptions or non over the counter drugs, and overuse of antacids contribute their irrational use, as well as people often fail to understand what is acidity and confuse indigestions for it. And most of the time antidiarrheal drugs along with the metronidazole single drug therapy is enough, but sometimes we can add into that ciprofloxacin with metronidazole or prescribing. Irrational use of antibiotics are also nowadays we are seeing, and especially like respiratory system drugs like salbutamol. These are all potent drug for the asthma purpose, but taking for common cold and bronchitis purpose, salbutamol used widely. And over-the-counter drugs, non-prescription drugs, most of the codeine drugs and dextromethorphan, as well as the narcotic analgesics. These drugs are leading to additive effects, and other miscellaneous drugs are also using for anti-diabetic drugs, anti-hyperlipidemic, as well as the anti-hypertensive drugs also. because not filling the prescriptions and using for the longer time, and it can lead to a problems. So what are the steps are there for improving the rational drug use? So how it can be done like? So according to the WHO recommends, there are 12 key interventions in order to promote the rational use of drugs. So like there are 12 key interventions are there. I'll tell you like one by one. One is the establishment of a multidisciplinary and national body to contribute the policies on medicine use, followed by use of clinical guidelines, then development and use of national essential medicines list. Because here, like essential medicines list, there are some drugs list is there. According to that, we should follow, and we should see the regulations. Establishment of drugs and therapeutics committee in districts and hospitals also, and inclusion of problem based pharmacotherapy training in undergraduate, we can add into the curriculum. And continuing educations is required for the healthcare system, and medical educations, licensure requirements, supervision, audit and feedback is important for the use of the rational reviews. And supervision is important, as well as auditing and feedback we should take, use of independent and informations on medicines. The ninth one is very important here, important role is public educations about the use of the drugs, how to be taken, when to be taken the drug, how long it should be taken, and how when they should come for the follow-up of the patient. So these are very important, and patient educations regarding the over-the-counter drugs, non-prescription drugs, what are the disadvantages are there, we can educate to the public. And avoidance of the powers for financial incentives, use of appropriate and enforced regulations are important. Sufficient government expenditure to ensure the availability of the medicines and staff. According to the WHO, there are some drug use indicators are there. The first one is the prescribing indicators. Like here, like what they have made it for the prescribing indicators, like we can take the average number of drugs per encounter, and percentage of drugs prescribed by generic name, how much percentage is there for the especially using of the generic drugs, and percentage of the antibiotics prescribed, percentage of the injections, how much how many percentage is there for the parenteral preparations, injections, either as well as the topical purposes also can be used. Percentage of the drugs prescribed from essential drug list or the hospital formulary. So second one is the patient care indicators. Average consultation time, how much time is taking for the consultation, average dispensing time, percentage of drugs actually dispensed, percentage of the drugs adequately labeled, and knowledge of the correct dosage. Patient knowledge is also very much important here. Patient education is most important. Coming to the facility indicators, here there are two they have given is availability of the essential drug list of the formulary, either availability of the key drugs. The fourth one is the complementary drug use indicators, like for example, percentage of the patients treated without drugs, and average drug cost per encounter. Percentage of the drug costs spent on mainly for antibiotics, either antimicrobials. Percentage of drug cost spent on the particular injections. So how much is there? So prescriptions in accordance with treatment guidelines, percentage of patients satisfied with the care they received, percentage of the health facilities with access to the impartial drug informations. These are important guidelines. Coming to what are the different guidelines for rational prescribing, how we can improve for the rationality. So first of all, we should aware of patient problem. What are the complaints are there? What is the previous medical history is there? And previous medication history. These things are important to monitor. Wait, sorry. use drug only when indicated and when potential benefits outweigh the risk. Like wherever it is necessary, then only we can use the antibiotics, and we can use the other than antibiotics also. If it is necessary is there. Unnecessary using of drugs can lead to a adverse drug reactions, or otherwise hospitalization, long hospitalization stay will be there. Choose a drug of proven efficacy as well as the safety, and must be suitable for the individual patient. Avoid using more than one drug of the same chemical class at the same time. In each prescriptions, like we should check it, like how many the same class of the drugs have been prescribed, and should not be like more than one. And inform the patient regarding the how to be taken the drug, when to be taken, how long you should be continue the drugs, and what are the minimum side effects can occur, what is the dose is there. So these things should be told to the patient. Coming to monitor the effects of the particular treatment, decide whether the drug should be continued at the present dose, either it should be stopped, either if treatment has not been effective, and we should identify the reason for the why it has not effective for the particular treatment. So how it can lead to a misuse of antibiotics, especially for common cold, cough, fever can be also given for the antibiotics. So here, like we should try to avoid common cold and all. It will subside if it is viral is there. It will subside after 3 days, either 5 days, either 7 days, without giving any antibiotics. Like, and upper respiratory tract infections, mainly for pharyngitis, laryngitis. So it will be there for viral also. And starting antibiotics without any diagnosis, and frequently changing of antibiotics can lead to a resistance, and giving suboptimal dose and not completing the course of the treatment. If it is, for example, azithromycin should be taken 3 days for the durations of the therapy. If we will discontinue after 2 days, then it may have the resistance. So like complete course of the treatment is very, very important, and we can educate to the patient. So how we can minimize the irrational use of the antibiotics, how rationally we can use it. Use antibiotics only when it is indicated, depending upon the organism. Before commencing any antibiotic therapy, either specimen for gram stain, either gram positive organism, either gram negative organism, depending upon the culture, depending upon the sensitivity testing should be obtained, then only we can start the antibiotics. Choice should be based on suspected positive organism, either gram positive, gram negative is there, either depending upon the organism, depending upon the microorganism, it can be given the antibiotic. Safety, previous clinical response, cost is also one of the major aspect, and ease of use, potential for resistant organism, and we can use the adequate dose and duration of the treatment, depending upon the age factor, depending upon the whether patient is geriatric, either pediatric, either pregnancy is there, lactating mother is there, either mental retarded patients are there. Depending upon that, the dose can be given for the particular patient. So very important is history of allergy of the any adverse drug reactions, history of any allergy of the particular drug, sensitivity. So these things are very important, and prophylactic use of antibiotics should be restricted. Oral therapy preferred more than parenteral therapy, but sometimes if the patient is conscious, and that time oral therapy can be preferred. If the patient is unconscious, either patient needs urgently for parenteral therapy, then we can go for injectables, either IV fluids. So antimicrobial combination should only be used where it is indicated, more effective and least toxic, and wherever it is necessary for topical antibiotics, restricted to few proven indications. Coming to rational use of injections, mainly oral administration is not tolerated. In that conditions, we can go for the injectables. If it is absorption problem is there, absorption issues are there, then we can go for the IV injectables. Drug of choice formulated as the parent drugs. High tissue concentrations are needed. Urgent treatment is required. Immediately patient needs the particular drug. That's why like injectables can be preferred. Not comply with oral therapy. In that conditions, we can go for that. So what is the role of pharmacists contribute towards the promoting the rational use of drugs? The first of all, we should involve in the activities like member of drug and therapeutic committee, and how to be stored the drugs, drug procurement, and drug storage is very much important, because most of the vaccinations and as well as the some of the anti-diabetic, especially for insulin therapies and all, the storage conditions, if it is not maintained properly, then it can lead to toxic and deteriorate the drug. So very important is the drug storage, and correct dispensing can be done. Then patient can, and we can give the educations for the patients regarding how the therapy can be added to the medications. And very important is drug information services. Whenever it is necessary for any healthcare professionals, we can provide the drug information. And if it is newer drugs are there, if it is any coming to the market, if not aware of the drug regarding the evaluations, pharmacological actions, either indications, either dosages, not aware of the drug. So in that conditions, like clinical pharmacist role is to give the information to the healthcare professionals, and we should provide the pharmaceutical care services to the needy people. Role of pharmacist in promoting rational use of drugs in dispensing setup. Like the pharmacist shall keep all controlled drugs in a locked cabinet under his or her own direct supervision, and control should be made. The pharmacist must check validity of the prescription and identity of the patient before dispensing. So we should thoroughly check the prescriptions. What is the date has to be written. Sometimes if they brought any refilling is there, either fresh one is there, we should check the date. Either some patients we have seen same prescription, they are using it for 10 years, 20 years. So that we should check the date of the prescription. The pharmacist shall consult the prescribing doctor if there is any doubt about the prescription. Pharmacist should only dispense controlled drugs if the prescriptions provided by the physician is complete and the valid. Pharmacist shall properly label and mark the containers to avoid the undue undermixing that may cause harm to the patients. Mainly it happens in the cytotoxic drugs for the cancer patients. The pharmacist shall provide complete information to the patient about the prescribed drug he or she is dispensing, including cautions, warnings, and clear directions for the use of drugs. Under the current regulations, the pharmacist is not permitted either refill, either the substitute the drugs. So regulatory measures to support rational drug use, registrations of medicines to ensure that only safe, efficacious medicines of good quality, and limiting the prescriptions of medicines, and prescribing includes limiting certain medicines, and cooperation is very much important for the health case. Yeah, licensing of health professionals. So all are involved for better patient care, and we should monitor the particular drug after giving the treatment. So these are the some of the leaflets what here like how should be taken, and how OTC drugs are not safe. So these are there. So these are the references of the particular topic. Thank you.